there have been a tremendous number of executive orders and discussions around language access on a federal level. And I want to ask, because there's a lot of confusion about what's required, what do these changes mean? Do they really change anything in terms of what people are obligated to do morally, legally? And so what's your take on that?
I completely agree with you that it has caused a lot of confusion, and I almost feel like the biggest impact of these executive orders has been creating fear and confusion. The bottom line is, if I had to say one thing without expanding on it, I would say that healthcare providers that receive federal funding, healthcare providers are still legally obligated to provide meaningful access to patients who don't speak English. The two major executive orders that people talk about, now to expand on that. So the first executive order was signed in March of 2025, which designates English as the official language of the United States. And basically that just means that that recipients of federal funds are no longer required to implement language access plans that ensure patients with limited English proficiency can access services. That said, how I started this conversation was that we're still legally obligated to provide meaningful access. What this new the executive order that I'm talking about from March is executive order 14224. I always confuse those numbers, but 14224. And what that did is it revoked executive order 13166, which did so much to improve access for patients or people with limited English proficiency. And it really operationalized Title VI. So I think what this new executive order does is it kind of weakens the need for equitable communication. It eliminated the federal government requirement for agencies to develop language access plans, like I said. It reduces emphasis on meaningful access. Of course, with the federal cuts, there are fewer compliance reviews. I think in general, this just leads to a lot of inconsistencies in language access. And it could potentially also reduce the availability of language services for limited English proficient individuals.